operation. Tonsillectomy operation is when you remove the tonsils, and you can see them here in this video on left and right, those little meatball type things. In the middle you can see a dangly thing hanging down, which is the uvula, or the punching bag as some people call it. And at the bottom of the screen you can see the tongue, which has been covered up by the tube that goes into the lungs, and also the metal spatula that is holding the tongue out of the way. So the first thing you do in this operation is use the Dennis Brown tonsil holding forceps that you can see here, and try and pull the tonsil towards the middle of the throat. Now these new blue forceps that are coming into view are known as the bipolar forceps. We use these to cauterize the skin inside the mouth so it doesn't bleed so much. You can see here I am using it at the junction between the tonsil and the rest of the throat. Once I've done this, I can use my scissors to carefully cut the tissues between the tonsils and the throat. Now if you look very carefully, you can see on the surface of the tonsil there are these little blood vessels that I need to cauterize, otherwise they will bleed as well when I start taking out the tonsil. Now there are lots of different ways of removing tonsils, and this happens to be called the bipolar dissection technique. Once I have videos of the other dissection techniques, I'll post them on this channel as well. The important thing to remember about the bipolar dissection technique, that you should try and reduce the amount of cauterization you do during the operation. It's worth cauterizing even the small blood vessels to stop them from bleeding later on. And you can see here also that I'm not always using these bipolar forceps for cauterization. I sometimes just use it for dissection. This speeds up the operation, makes the whole thing less traumatic for the patient. You can see here I'm slowly dissecting around the tonsil and trying not to damage any structures on the side of the throat. There's often quite a big blood vessel at the bottom of the tonsil. You can either tie this area off or cauterize it again. You can see here I've accidentally left a little bit of tissue behind at the bottom of the tonsil, so I'll snip that off as well. So all we have to do now is have a look around at what's left over and see if there's any bleeding spots. Although it's a little bit difficult to see, there's only one spot that I could see that was still bleeding, and I've cauterized that again. And that's it, I've removed the left tonsil. Now we go on to the right side. So now we go ahead and hold the tonsil with the Dennis Brown holding forceps again. Then we use the blue bipolar forceps again and slowly cauterize around the tonsil. You can see here I'm not exactly on the junction between the tonsils and the throat. What I'm trying to do is stay more on the tonsil. The reason for this is that if you spare as much of the tissue that isn't tonsils, and therefore you're not removing any extra tissue including the tonsils, the less painful the operation becomes at the end. I did a small study on this in 2011, and I found that when you performed a pillar sparing tonsillectomy, the pain scores of these children and these adults reduced by just over 40%. That reduction in pain scores was still evident about 7 days later. You can see here I'm doing the same technique. I'm cauterizing and sometimes using the scissors to slowly dissect away at the junction between the tonsils and the side of the throat. I try my very best to stop the bipolar forceps from digging into the side wall of the throat, because sometimes that causes bleeding and pain later as well. You'll see me flicking the blue tonsil bipolar forceps away from the tonsil and away from the tonsil bed to avoid any bleeding later on. Now we get into the end of the right hand side. I'm going to cauterize the inferior pole of the tonsil and then remove it. Now all there's left to do is to look around for any extra bleeding that might be left behind, and then we've completed both tonsils and the operation is over. As you can see, the operation is quite short, and although I've edited this operation a little bit, the actual operation lasted less than 8 minutes, at 7 minutes 52. As I said before, there are lots of different ways of doing a tonsillectomy operation, and I'll try and show you videos about all of them. If you have found this content useful, please do like the video, as it really does support my channel. But for the meantime, this operation is over.